I am so honored to introduce our featured speakers today. So first we have Dr. Moshin Ranathunga. He's the head of programs at Amref Health Africa in South Sudan. And joining him is our very own Bob Kelty, CEO of Amref USA. Together, they're going to dive deeper into the call right now. So Bob, over to you.
Thank you, Erin. I don't normally do this, but before we start the Q&A, I'm going to want to share a bit of my own experiences in South Sudan. Because 30 years ago, I saw firsthand how nations can come together to support countries like South Sudan in times of crisis. It was my first time working in another country and that was during South Sudan's civil war. I arrived near the end of a devastating famine and saw how drought and conflict pushed entire communities right to the edge. But I also saw the difference it makes when the world shows up. At the time, I was part of USAID-funded logistics team working with UNICEF and the World Food Program during Operation Lifeline. It was a massive international effort with 40 countries coming together to deliver food and medical supplies to millions of people caught in the middle of South Sudan's civil war and famine. The U.S. government provided billions of dollars to Project OLSL, helped save part of saving as many as 4 million lives, distributed more than 2 billion pounds of food. Many of the wealthy nations that stepped up during Project Operation Lifeline Sudan have stepped back now. U.S. government's pulled its funding from South Sudan, made deep cuts to UNICEF and World Food Program, nutrition programs, and left millions of people even more vulnerable. But Amref is still committed. We've been working in South Sudan for over 50 years, trained 66% of the country's health workforce, and we just really have helped build lasting systems. So that's kind of the initial, and then I really wanted to, have a conversation with Dr. Moshin, who has been in South Sudan for 14 years, even, right before, I think South Sudan's been independent for 13 years, so before the independence. So he's seen a lot of what's going on, the changes and there. So let's hear directly from him. Dr. Moshin, do you want to introduce yourself in more detail?
Thank you very much, Bob. Thank you for having me. Yes, so my name is Moshin. I'm the head of programs for Amref Health Africa in South Sudan, and I lead all the programs in all the states that we work in. I have been working in South Sudan for about 14 years right now. In that time, I worked in the capacity with UN, with United Nations Mine Action Service, UNDP, as well as then coming into Amref through Amref Italy, and then finally through Amref South Sudan. So this is a brief idea of my background. And over the years, I've seen South Sudan trying to change, trying to implement, and trying to gather its efforts to try and move forward. However, there's always setbacks that come in, and the work that we do is quite important, and this is where we are here. Back to you, Bob.
Yeah, why don't you tell me what it was like before the, not just the United States, but, all wealthy countries in the North, what it was like, how South Sudan was, moving towards, improving their health systems, and now what's it going to be like? Have the immediate changes going to be, and what does the future look like?
Right. So just to take you a little bit back, I came to South Sudan when South Sudan was just an idea. They had not attained their independence yet. So they had just signed the peace treaty. They had just signed the PCA, and the referendum had gone through, and they were expecting to be independent in July, which they did. So back then, there was so much hope that this new country, the youngest country in the world, had so much hope. They wanted to be independent. And as such, with such an outlook, with such a setting, it was predominantly reliant on foreign aid, mainly being the US. And as you very clearly mentioned earlier, South Sudan would not exist without the support from the US government. Simple as that. I mean, everything from the health infrastructure to nutrition to schools, essentially everything was under US aid, or either through the Bureau of Humanitarian Assistance or through US aid. I mean, if you look at it critically, even the little bit of electricity that we have in Juba, that is the capital of South Sudan, is purely because of the US aid-funded electrification project. And even the subsidization of the amounts that we pay for electricity was simply because of US aid. Now, with such a heavy reliance on foreign aid, I do have reason to believe that South Sudan will face its largest, if not the largest, challenge yet that is keeping the country moving forward. Again, like I said, US aid, US and the US invested so heavily that we would not see South Sudan to this point had it not been for the US. And looking at it from a very diplomatic angle, a lot of support has left. Again, part and parcel due to political instability, also because of other forms of crisis, and also the effect of the Sudanese crisis that is spilling over to the south. There is a notion that after 14 years, there is the idea that South Sudan has to improve on its own, but I do have reason to believe that there is still a lot to be done.
Yeah, and I mean, we hear a lot about, aid to be attached to our national interests, and it's, our East, African, like Kenya, are very important partners. So to have a really stable South Sudan matters, matters to the U.S. national interest. And we've invested, and there's such a connection between the United States and South Sudan. So let's kind of focus a little bit more about just what Amref is working on. Talk about our nutrition programs that we've already done, how we're working to keep them sustainable now with the drop in funding, and any challenges you see. I think you touched upon some of the challenges already, but you see facing that. But maybe kind of speak in what our partnership looks like currently with UNICEF and World Food Program, and then what we're doing to act.
Right. Thanks, Bob. So our nutrition program is co-funded by WFP as well as UNICEF. Unfortunately, a couple of months ago, UNICEF, because of the fact that they lost all USG funding, which was given to UNICEF through BHA, the Bureau of Humanitarian Assistance, UNICEF essentially stopped all activities in South Sudan. As a result of that, there was a massive gap that was created in not just in the areas that we work for our nutrition project, but also for the whole of South Sudan. UNICEF, though, continued to provide us with supplies, but it was still not really effective if we do not have a community-based approach leading to it. Now, we were lucky enough to have partnered up with GiveWell, who agreed over the span of the next 7 months to cover that gap. And that actually allowed us to negotiate with UNICEF to continue giving us supplies while we do the activities. Again, it's often always important to understand that working in a country where, again, it's quite heavily reliant on aid, it is always very important to have the aspect of how do I say this? It is always important to have an aspect of sustainability. Now, if you look at the nutrition program per se, it is co-funded, and that creates a very cost-effective method of implementing, where one party takes care of the activities and the other party takes care of the supplies. So with that in mind, it is important to understand that in order for us to make this program effective, we have to always look at it from a sustainable angle. We have to look at it from going to the very last mile, taking the supplies to the last mile. And then the other key effort that we try to strive in is to ensure that the program itself is sustainable at a point when there is no longer funding. Something that is key to this is that, look, in very simple terms, it is very easy to give food to people. It is very easy to give supplies to people. But we need to make sure we address the root cause of the problem, which is malnutrition and the lack of livelihood. So we moved tremendously in terms of, especially with the project and especially with the funding from GiveWell, we moved significantly towards the community-based approach where our aim was to teach the local farmers, to teach the local communities how to grow the food, how to grow their gardens, how to create vegetable gardens, and how to address malnutrition from that particular angle. So sustainability is always something that is very relevant in a country like South Sudan, because more often than not, when the project ends, when the money runs out, the project ends. And that is part of the reason why we are still here. We're still talking about needing donations, needing funding, but this is something that we needed to. This is something that we recognized as an organization, and we shifted towards a community-based approach.
You know, one of the things that I'm just going to add a commentary here or a comment that impressed me so much, gathering data anywhere is always challenging, but gathering data during a crisis and emergency program is pretty amazing. The South Sudan team has done a great job. I don't know if you want to comment a little bit how your team has been able to gather such strong data and how you've gone about that.
Sure. So the nutrition program in and of itself predominantly relies on the supplies. I mean, I remember I've been having conversations with Nicole when she asked me, why are you still talking about grams? Remember, the food that we give is given to children by their grammage. So as a result of that, every single packet of nutrition supplies, every single gram of soya bean, for example, that is given out to the children has to have a name attached to it. And this is one of the reasons why Amref was so highly profiled in terms of even getting supplies from WFP or UNICEF, was simply because we always made sure that we did our background checks, we did our on-ground checks. For example, if we knew a facility had treated so many children, there had to be this amount of supplies administered at this given point. So our system of maintaining our supplies, maintaining the numbers against the supplies distributed, are often always one of the highlights of the South Sudan program, not just for Amref, but for WFP and UNICEF.
Thank you. As I mentioned earlier, I had the opportunity to work with Amref's trained community health workers in South Sudan. From your perspective, what outcomes have you seen from their work and from what health outreach events, especially in the hard to reach areas?
So in terms of training the community health workers, one of the key things that we did right was localization. We picked the candidates, the people who were to be trained right from the community. Now that localization or the local aspect of taking those students or trainees per se into this program had several positive impacts as far as we were concerned. One was that the acceptance of services. Remember, we are talking about rural villages that are often engaged in traditional practices rather than Western medicine. So when we actually take from them people to train, they go back to their community and they see that this is their own people who are administering these medicines or giving them the advice. So as a result of that, this localized approach, one, created community acceptance of services, and secondly, it led to the continued service of pastoralists and people who were migrating. Remember, a large part of South Sudan is actually pastoralists. And if they are to be concentrated on a static facility, for example, they would not have services if they move from one greener pasture to the other.
You touched on the localization, and I've seen this too in myself, but I'd love you to kind of explain because Amref is a local African NGO, how is that different than when a U.S. international NGO comes in with, folks who aren't from the region or aren't from the country and, implements programs?
So localization, actually, I'll start with the first aspect of it. So localization allowed us to sort of understand the communities better. Just remember, South Sudan, even though it is a unified country, is 10 states that are completely different from each other. There are different communities. The terrain is different. Where you use boats, you have to use donkeys somewhere else. So the idea that the idea that Amref has been operating in South Sudan through Sudan for over I think since 1972, essentially allowed us to understand the country as a whole. And we knew every single bit of this country, every single state, because it was a lot of, more often than not, Bob, there are instances when many foreign donors come to South Sudan with the notion that a one-stop sort of approach works for the whole country. It does not. They're very different from individual states. You are very different. It works very differently in certain regions. And the understanding that since we've been here since 1972, there was an understanding that we knew what we were doing and we knew how to operate in those independent states. There are pastoralists, there are farmers, there are people who are from other communities, there are Bedouins in the upper north. So we understood that aspect and we continue to strive to sort of build on that so that we highlight and we focus on the kind of sort of tailor-made program design for different locations. And this is where a lot of the other NGOs had struggled because they were under the impression that the whole of South Sudan would operate on its own as a single entity, when it is clearly not.
I remember when I started with my job in South Sudan, I was given a community health training book that was created by Michael Wood and his wife. And it literally it was partnered with WHO. It became the training manual that eventually became kind of the Bible for training healthcare workers, community healthcare workers globally.
No, that's absolutely true. That's absolutely true because Amref has also been instrumental in providing so many different guidelines, including the Boma Health Initiative, which happens to be the lowest level of primary healthcare, similar to CHW, community health workers. But also remember, when South Sudan gained its independence, there were hardly any ministerial structures, so as to speak. And us being Amref came in very predominantly to support the Ministry of Health. In fact, even right up until now, the Ministry of Health, who have their larger donors, still look upon Amref for their donors to give us the money, and we pay the salaries for some of the Ministry of Health staff. So we still have that backbone that we had back then when South Sudan was just still the youngest country in the world. We essentially, as Amref, filled in the gap to a certain extent of the Ministry of Health. And that is something that comes from years and years of being in this country. And as you said, yes, it's about 66%. And the way they describe here in South Sudan is that 3 out of every 6 health workers are trained by Amref.
Could you talk a little bit, you mentioned GiveWell, who's just come in to extend the program for 7 months, obviously, which is, bridge to others, and we're definitely, looking for other supporters. How can folks help?
I'm glad you brought out that question, Bob, because I would like to very clearly state that having strong partnerships, the one that we have with GiveWell, for example, the one that we have just developed with GiveWell, the one that we have had with WFP and UNICEF, what that essentially does for a project, and I'm going to speak purely on the nutrition project before I touch on the others, what that leaves us is a very strong foundation. Remember, South Sudan is a country with so many different gaps. And having such a strong foundation where WFP and UNICEF provides us the supplies and GiveWell is able to provide us the activities for community management of acute malnutrition, that is taking care of the mother-to-mother support groups, the community nutrition volunteers, taking care of the seeds, the planting, all of those, and the administration of something even as simple as the therapeutic milk. What this leaves us is that this allows us to look for other funding, and it doesn't mean that we need to have massive amounts, or we don't need large scale funding when we have such large partnerships, because it becomes one and the same when it comes to the project outcome. What I can tell you is that with such partnerships, such as the one we have with GiveWell, WFP, and UNICEF, this allows us to make sure that whatever funding we get and as an addition, no matter how small it is, will always go back to changing some life in the project. Because there is the notion that it is a large country, there are massive gaps, but these gaps are also very small when you break them down. Yeah, so what that means is that whatever little we get, it will always go back to a certain gap, because there are so many gaps, there are so many opportunities for us to leverage on funding, and there are so many places that need funding in general. So in addition to the nutrition project, we also have the youth and gender projects. We run the health system, because as Amref, we are essentially the ones that are leading three massive hospitals in South Sudan, including a teaching hospital. And all of those are relevant when we have a continuous effort to fund. I am hopeful that the international community will once again recognize the importance of having South Sudan as an ally, supporting them, and coming back to terms with the fact that this is a country. Yes, you have supported us for 14 years. I do agree. But perhaps pulling the rug from under our feet might not have been the right thing to do. And I'm hopeful that people will understand that no matter what political instability or whatever other reasons that there may be, by the end of the day, it is the child, the mother, and the patient that suffers. And if we understand that, maybe the idea of cutting off funding suddenly would not have been the case.
I think people have heard about the civil war in Sudan, the food insecurity there. What kind of pressure is that putting on South Sudan?
Immense pressure. I mean, one of the states that we predominantly work in, it's called Warab State. Just remember that there were already limited resources. There were already limited number of healthcare workers for the existing population. As it is, getting certain medicines, getting certain drugs were almost impossible into certain areas. Now, at the refugee crisis, where we're looking at about 1.7 million refugees that have come through, refugees and returnees, my apologies, refugees and returnees who had come back to South Sudan, has put a tremendous strain on a system that was already so fragile. So as it is, we are reaching a boiling point when it comes to some of these regions, where you have the host community and you have the community that came in as returnees or refugees. And there had been multiple instances when there had been clashes, conflict, and misunderstandings as a whole. So to be honest, this 1.7 million additional people that came in is adding such a burden into a country that already could not cope up with its own population. So it is a huge burden at the moment.
And I think a lot of times countries in the north don't realize how welcoming Uganda especially has worked with the communities from refugees from South Sudan, and really given back and very little restrictions, and really integrated that population into their country.
True. I mean, just to take you back a little bit, right now we are having the largest cholera epidemic right now as we speak. The largest number of cholera cases, the largest number of measles cases, all of them are being exuberated simply because of this crisis. Again, you have so many migration points. Remember, South Sudan is a landlocked country, so you have so many migration points that the government just simply doesn't have the resources to keep track of everything. I mean, we have had this the cholera crisis for the last 1 year, and it's going from one to the other. But to take you to a point in Uganda, yes, Uganda has been extremely open when it comes to the crisis and accepting people. Uganda, even Ethiopia, because there's a part that borders Ethiopia. So they have been extremely welcoming, extremely understanding, but again, as with all host communities, Bob, there is a limit that they can take in. I mean, if you look at Kakuma camp, for example, they were going to close it a few months back in Kenya. So, I mean, there is a certain level that you can go to before you say, guys, this is what we can do.
Yeah, yeah.
It's about time our own government looked after you. But we know that the government, not because they don't want to, they just can't do it. I mean, the oil has stopped. I mean, we recently started oil exportation, but then about 3 months ago, unfortunately, the entire stock, the entire oil dump was completely destroyed. So we are back to square one in terms of having absolutely no income coming as a country.
So why don't we open it up to questions from the audience?
Sure. I'm going to help moderate the questions. Hi, everybody. If you have any questions for Moshin, please put them in the chat at any point. We already have a few in there, which I'll share with you, Moshin. So the first is if you could share any success stories or moments from your experience working in South Sudan over the last 14 years that stand out to you, anything particularly impactful and inspiring. And I'm actually going to tee you up here. You're welcome to share, an anecdote from any point in your experience there. But I know just from the messages I've received from you in the last few weeks alone, since we have started resuming some of our nutrition activities with GiveWell's support, you said something to the effect of, we've never been able to administer this many vitamin A supplements in such a short period of time since at least any point in the last 8 years. And you also mentioned there was a village where we were able to go and provide nutrition services that hadn't seen a vehicle since the 1970s. So I'm going to tee you up there, and maybe you can talk a little bit about that. And then, of course, if there are other experiences that you want to highlight, the floor is yours.
Sure. Thank you very much. True. I mean, we were allocated, I believe, 42,000 doses of vitamin A. We finished that in 4 days, and the campaign is supposed to go for 7 days. We had to send vehicles to the state county headquarters to get us more vaccines. We had never seen this level of administration, because again, remember, it's very far. It's very remote. This is a region where a mother has to walk 3 to 5 days, in some occasions passing through war zones, to come and bring their children to get even the therapeutic milk or the vitamin A supplementation. That level of, I mean, the amount of work we were able to do in this campaign was something that was highlighted even by the national government, not just the state government. And we were able to, thanks to funding from GiveWell, we were actually able to reach a village that was about 174 kilometers inland. Remember, there was no road. There was absolutely no road that we could go. So we had to hire motorbikes. And the motorbikes went in front and the pickup truck with the supplies came at the back. And I was made to understand that some of the older gentlemen in the village came out wanting to know how the civil war was going, because they had never had internet access. Sorry, they had no radio network, they had no telephone network, and they were still under the impression that the civil war was still going on with the North. And it was just unbelievable when we went there, when our team went there. They were so appreciative. They had offered to give them their livestock, their chicken. They said nobody had ever come to visit us. And we knew this village had existed. Nobody could really pinpoint it before. So we had to send motorbikes everywhere trying to look for it. And it was one of the most underserved communities in that region. It is a very small minority of about 2,000 people, and they had never, ever had this level of services come to them. I mean, it was not just the vitamin A. We actually took medicines. We took soap. We took basins for them to wash, collect water. They had never had this before. And they said for the last 40 something years, we had never seen an outsider who was not from this community. And it's both tragic, and it was heartwarming and tragic at the same time. And this is just one of those villages. We have I have reason to believe we have close to 17 such villages in that region. We don't even know where they are because we can't even find them on Google Maps. So it was all word of mouth that we saw this boy running into the bush, and that is where we followed him, and that's how we found him. So again, every bit of service, every life that you change, in fact, is a success story. Because I mean, I have had operations, surgeries, deliveries. Uh, there've been children named after me in that region. So it's always a success story because their heart is so pure. I mean, it's a country that has seen so little input that whatever we give to them, it means so much. And I always make this distinction that even if you give them a pill of Panadol or buy them an ambulance, the appreciation is always the same. They do not differentiate.
Thank you so much, Moshin. I always love listening to your stories, your anecdotes, big and small. I learn something literally every time I talk to you. So just moving on to some of the other questions. There was a question in the chat about what is the population of South Sudan?
We're looking at about 12.7 million. Just keep in mind that the last census that was done was in 2002, in 2002. And culturally, from a cultural, I suppose it is important to understand the cultural significance of taking a head count, because in certain communities, in certain cultures within the South Sudanese demographic, infants and children who are below the age of 5 or 6 are not counted as part of the census. It is their community belief that they are still within the mother's reach and they should not be counted as a full person. So there is a little bit of a back and forth in terms of what exactly the population is, but it rests between 12 and 13.
Okay, thank you. And then we have questions in the chat. I'm going to sort of group them together a little bit about sort of economic development and the education system. So if you could talk a little bit about what the education system looks like in South Sudan, and as well about what the government is doing to sort of invest in economic development, whether it's sort of in the agricultural sector or in the natural resources sector. Just what are these systems surrounding beyond the health sector that might be having an influence on the health of the country?
So the education system in South Sudan is very similar to that of East Africa. You have the nursery, primary, secondary, then university. However, in the same manner with which we are having so many drawbacks and gaps with the health system, the education system in and of itself is predominantly donor funded, in which case it is mostly FCDO, which is the British government, as well as the Swedish and the Japanese government that has been sustaining or holding the education system in South Sudan. It is very limited. I have reason to believe that it is about it. The acceptance rates of the families to send their children to school in a vast majority of the communities is very low. Again, remember, these are pastoralist communities. A large majority are pastoralist communities, and they move from one place to the other. I know that the education system had once come across an outreach form of education. However, that has not really been as successful as what we do for health and nutrition. Again, funding gaps, difficulties, lack of any equipment or a lack of supplies had always been part of the reason. But the education system is extremely fragile to a point where those who actually have a little bit of disposable income to educate their kids eventually end up sending their children to Uganda or to Nairobi. What this essentially does is it keeps just simply eroding the education system in South Sudan even further. Because if there are no children, there are no school fees. And if there are no school fees, then why is there a need to build better schools? And that is something that has always been a problem for the last 14 years. And we have tried to address this from a health point of view. Whenever we go to schools, we try and educate the children to understand where they are. I mean, it is important for them to come to school. We also try and incorporate nutrition into their activities in terms of having shows on livelihood farming. We teach them how to grow. We teach them on animal husbandry. However, as with any government structure in South Sudan, the education is not without its faults. The education system is not without its drawbacks. In terms of the natural resources, South Sudan is extremely rich in natural resources, both oil, gold, so on and so forth. However, these are predominantly taken over by, for the lack of a better word, multinational companies that have more or less taken over these systems. And there is very little of local governance, and there is very little of local ownership, apart from using the local people to work on these regions or work on these sites. But apart from that, there is very little benefit that comes in to the country apart from what is given as taxes or what is given as the ownership.
Thanks, Moshin. There's another question in the chat about, and I'm going to paraphrase this. I hope I'm not twisting the intention of the question, about sort of the balance between serving community needs and the local people and sort of what is being asked from the government locally or nationally in the case that, you know, those things are not always aligned. And just given the sort of insecurity and conflict that you are working in, you know, the difficulty of that environment for Amref and our staff and our, you know, fellow development partners that are implementing this work. How do you balance all of these different conditions, all of these different needs, and ensure at the end of the day, the work can be done well, it can be delivered safely for the humanitarian community and also in the best interest of the people that are being served?
Right, that's actually a very good question because I'll take an example of the Ministry of Health. At the moment, as we speak, there is a strategy, but that strategy for the Ministry of Health in South Sudan has not been cascaded onto the state levels. And what this has led to is that, as you very rightfully said, there are certain expectations that come from these ministries, and sometimes these expectations are not necessarily what is right for the local area or the local region. This is where we actually leverage on our strong understanding of the region. And to be honest, we have been, as Amref, we have been in this country even before it existed. So we knew what was needed, what was essential. We knew what the gaps were, taking into consideration whenever there is a project, we always get the community involved. Whenever, even before we do a proposal, our first thing we do is to look at what is needed in the community. I know that in most cases, it is more important to go first to the ministry. However, in order to avoid any sort of conflict, it is often always better that we go to the community first, discuss with them, find out what is needed, because we have presence in just about every state in South Sudan. So whenever there is an opportunity, we always know where where it is that is needed the most. So we would go into that region, talk to the communities, talk to the paramount chiefs, talk to the elders, and find out what is needed the most. And then we translate that to the Ministry of Health. That way, there is no conflict, so as to speak. That way, when the ministry sees us coming, they know that we are coming with something important. And for them to jump in and put perhaps their own initiatives might be frowned upon at that point, and we have a fairly decent backup. We could always say, look, this is what the community wants. However, you are saying this. I think it is better that we go ahead with what the community wants. And that has always been a bit of a problem, a bit of a challenge. And I can assure you it is going to be even a bigger challenge, because at the moment, most of the funding parties that were supporting the ministries, not just the Ministry of Health, are not available anymore. And it is the remaining partners who have a little bit of funding who are trying to do what we can. But again, they're coming with a lot of expectations. And when that happens, there is always that challenge. But we are able to discuss. I mean, we have always had good relationships with each and every ministry, the Ministry of Labor, the Ministry of Health, the Ministry of Gender. And they do understand that when we, quote unquote, put our foot down and say, look, this is what we are going to do, they do have a strong reason to believe that we are doing what is best for the community.
Well, thank you. We are at time. I just really want to thank
everyone for participating. Great questions, Moshin. Thank you so much for giving so much insight. It was such an interesting conversation. Really appreciate it.